Well, let's talk a little bit about some of the terms that you've discussed already. I know some of these terms before I started doing this work, I had no idea what they meant. So let's talk about what's a digital rectal exam, what's a flexible sigmoidoscopy, what's a barium enema, and what's a colonoscopy. We hear that term a lot, but let's kind of define it for our viewers. If you would take some time and give us some good um, definitions of those types of screening.
Well, I'll be glad to, Counselor, and I appreciate the fact that you established kind of a hierarchy from the least invasive to the most. It makes it actually pretty easy to follow your request. A digital rectal exam is an exam performed by a physician or a nurse practitioner where they simply take a gloved finger and lubricate it and insert it in the rectum of the patient. Now, obviously, any abnormalities, lumps or bumps or tender areas can only be appreciated up to about 3 or 4 inches at the max. But this is still has a real purpose in the diagnosis of colorectal disease. And so this is something that it seems to be simple. It is sometimes deferred. I see that note a lot in medical charts. When they describe a physical exam, they'll say, rectal or pelvic deferred. Sometimes the patient doesn't want the exam, and who wants that exam? However, it's extremely important, and it can pick up particularly, anorectal tumors. That's tumors that are way low in the GI tract that may actually be missed during a barium enema or colonoscopy or flexible sigmoidoscopy, because sometimes that first inch or two is actually missed because of the way the procedures have to be done. So this is an important point.
Let me stop you right there. We had a case a few years ago where the diagnosis of rectal cancer occurred about 2 inches up up the anus. And what we found out was when we got the medical chart, we looked at the primary care physician's records, and it had indicated several times that this person had gotten a digital rectal exam. And certainly, if it was performed or performed correctly, that cancer would have been diagnosed because it was within the 3 or 4 inches that the physician's finger would have been able to inspect. And it turns out they didn't diagnose it early. When they did finally diagnose it, it was a stage 4 disease. And unfortunately, this female passed away as a result of rectal carcinoma. And that's an example of a doctor who either didn't perform the procedure, or if she did perform it, didn't perform it adequately. So, didn't mean to interrupt, but I just wanted to talk about the importance of the digital rectal exam and how, if that's not done appropriately, can really lead to some devastating results. So continue, please.
Well,
Thank
well,
you.
just to tag on that, I've got to say that that's not necessarily an unrealistic scenario. I know and have seen physicians who have documented physical examinations that were not performed. And sometimes in the more delicate areas of the body, there's more of a tendency to do that among physicians that are really straining the boundaries of medical ethics. So that's very possible. Also, sometimes physicians are not as aggressive in examination as they need to be to gather the information that he or she needs. And this is also very much probably more common in pelvic exams with women. In that some physicians are real gentle, but as a consequence, they're not able to appreciate masses or tenderness or abnormalities. So they document a pelvic exam when actually they haven't gathered any important information. Let's go back to the other screening techniques that you mentioned. The next one that you mentioned was a flexible sigmoidoscopy. Now, in this scenario, the technique employs a lighted flexible tube about this long, and it has a fiber optic cable within it that's attached to a camera or to a direct viewer. And what happens is that a physician, typically a family practitioner or an internist, not trained in gastroenterology, will insert this tube with lubrication and usually some sedation to the patient, and it should examine everything from the distal anus through the rectum, and then in the lower left portion of the colon called the sigmoid colon.
Is it about 36 inches long? Is that how long those?
Well, the actual instrument's only about 24 inches long, and it typically only will inspect, only really trying to inspect about anywhere from 12 to 16 inches of the colon itself. Now that is because the majority, the great majority, probably as many as 80 to 85% of colorectal cancers exist within that length of colon, and they typically do arise. Again, the vast majority arise in the distal part of the colon, that is on the left side, on the